Hi everybody, it's Dr. Hager here. Today I'm going to be talking about multisystem inflammatory syndrome in children, or MISC. I know a lot of you have heard about this and have sent in questions, so I want to make sure that we break this down into a few sections to go through all of the information together. So the first part is, what is MISC? The second is, how serious is this condition? And the third is, how common is it? Or rather, how rare is it? So for the first part, MISC is a newly described condition in children that seems to be related to COVID-19. And just like with COVID, the information that we are receiving is changing from day to day. So what I share with you today could be different a day from now, a week from now, or a month from now. One of the most important things that I want you to take away from this video is that children who are developing MISC are presenting extremely sick. This is not a mild illness that can easily be missed. These children look ill. This is primarily due to the effect that it has on their heart. Most children are presenting with fever, but high fever in the range of 101.5 to 104, as well as GI symptoms, so nausea, vomiting, diarrhea, and abdominal pain. Some kids are also presenting with rash, redness of their eyes, lips, or tongue, swelling of their hands or feet, cough or sore throat, muscle aches, and joint pains. One thing that seems to be consistent among studies is that the time frame between the onset of COVID infection, the initial acute infection, and the development of MISC is about 25 to 30 days. So how serious is MISC? As I said, children are presenting very ill. This is a serious condition, and most kids are requiring care in an ICU level setting. However, the majority of children that have been diagnosed with this condition have been discharged home, fully recovered, and have normal imaging of their hearts. So even though there was damage to the functioning of their hearts previously, it recovered fully during their stay in the hospital. So this is excellent news. There have been 6 cases of death due to MISC in the United States out of nearly 300 cases total in the US, but the majority of children are recovering very well. In the similar inflammatory condition, Kawasaki disease, we look for the most part long-term for what we call coronary aneurysms, so blood vessels around the heart having abnormalities. And there have been a handful of cases of this in MISC data, but it's hard to know if they truly had MISC or perhaps they actually did truly have Kawasaki disease. Either way, longer follow-up is needed to understand the potential long-term complications of MISC. And then lastly, how common is this condition? Unfortunately, we do not have an answer for this. We can do a little bit of extrapolating and give an estimate. So we know that only 2 to 5% of positive COVID cases are children. And so if we have something in the range of 3 million cases currently of COVID, and we have about 300 cases so far of MISC, that puts the incidence of MISC at about 2 to 5 per 1,000 children. However, this estimate is probably very high, and a recent study out of New York State estimated more in the range of 2 in 100,000. In general, children are having much more milder symptoms or are even asymptomatic from COVID infection, so they're just not tested as often. So it's a lot harder for us to determine the incidence of MISC because we have less data on children and COVID. But overall, children are recovering very well, and this really does seem to be a very rare condition. I hope you found this information helpful, and if you have any further questions, don't hesitate to reach out, and I'll speak to you soon in a new video. Take care.